changed to PMOS. The term is changed to PMOS. From a very long time, there is a misnomer for PCOS, calling it polycystic ovarian syndrome, which is a misnomer because there are no cysts in the ovary. They are all follicles that are arrested in the ovaries at a particular size without getting ovulated. So there are no cysts in the ovary. So the term itself is a misnomer. So it is changed to polyendocrine metabolic ovarian syndrome. Why? Because PCOS does not really depict the problem itself. Only this PMOS is a new term that is coined, which actually depicts the problems that are involved in patients with PCOS, the traditional name. So, what is that? Polyendocrine metabolic ovarian syndrome. So, what is a polyendocrine disorder? So, there are several endocrine problems that are involved in PMOS. There is a problem in secretion in luteinizing hormone from the pituitary gland in the brain. The LH secretion is increased. From the pancreas, there is increased insulin secretion and there is increased androgen secretion, which means male hormone secretion from the adrenal gland. There is a gland called adrenal gland, which is situated on the top of the kidney. So there is increased androgen secretion from this gland, and there is hormonal imbalance and arrested oocytes in the ovaries, which we usually call as polycystic ovaries, which causes hormonal imbalance. So the combination of all these endocrine problems cause hyperandrogenism, means increased testosterone or male hormone levels in the body, and increased insulin in the body and insulin resistance, and ovulatory dysfunction, which means the ovulation does not happen properly, leading to irregular periods in women, and hirsutism. Hirsutism means abnormal growth of hair on unwanted areas like facial hair, etc. And increase in acne, means pimples, weight gain, infertility problem, and structural problems in the ovaries. So, what is the metabolic changes that happen in patients with PMOS? It is a polyendocrine metabolic disorder. So, what is a metabolic disorder that happens? There is increase in the fat, central obesity, which means fat in the tummy. So, there is more tummy fat in women, which actually happens in PMOS, and this in turn worsens insulin resistance. There is fatty liver, there is increased risk of fatty liver and abnormal glucose levels. So there is a risk of having high sugars in the body, and there is a risk of hypertension, elevated blood pressure, and cardiovascular problems. So, and chronic inflammation and oxidative stress happens in patients with PMOS. So, there is a risk of type 2 diabetes, means diabetes, heart disease, stroke, fatty liver, and infertility to women who are suffering from this PMOS. What are the other effects? Psychological changes. So, women with PMOS usually suffer from anxiety, depression, eating disorders. Most of them try to lose weight by following some diets, but they'll not be able to continue for long because they will have this stress eating disorder. They will have poor quality of life also. So, what are the common symptoms of PCOS that we see? Irregular cycles, missed periods, weight gain and difficulty losing that weight, acne and oily skin, excessive facial and body hair, hair thinning on the scalp, dark patches on the skin, especially on the neck area and underarm areas, and difficulty in getting pregnant. So there are some common key points that most of the teenagers have to understand. Periods may be irregular after getting the first period. Usually after the menarche, after the girl attains the first period, for the first 2 years, the periods might be irregular, which is very common. So we should not mistake it for PCOS, but you should get evaluated. Acne and weight gain are common in teenage very common in teenage, but proper evaluation and diagnosis is important. Emotional stress can increase the symptoms. So they will not see stressing the teenager to lose weight, to not eat whatever is liked by the teenager, causes more emotional stress and it might only increase the symptoms. So support from family is very important. Healthy eating habits and healthy habits per se should be started early. So it helps a lot. And you should also avoid self-medication. So why does PCOS actually happen? Why does it happen? So the exact cause is not fully known. Usually family history of diabetes in the family, like diabetes in the mother, diabetes in the father, will increase the risk of PCOS. Insulin resistance plays a very important role and hormone imbalance leads to irregular ovulation. So, what are the lifestyle changes? Actually, lifestyle changes help a lot in PCOS. So, healthy food is first most important. 80% of PCOS usually disappears if it gets benefited. People will get benefited through adapting to healthy food habits. Next comes exercise, sleep, and stress control. So, I would like to emphasize on yoga, how yoga helps in PCOS. So in PCOS, there is definitely chronic stress. So chronic stress increases the levels of cortisol, which can increase the or worsen insulin resistance and hormonal imbalance, further causing weight gain and menstrual irregularities. So yoga asanas like Surya Namaskaras and Balasana, child pose, Bhujangasana, that is cobra pose, bridge pose. So all this help you to reduce the cortisol level along with breathing practices. If somebody does breathing exercises also, it activates the parasympathetic nervous system, thereby reduces the stress, improves the insulin sensitivity. So the PCOS also there will be improvement in this PMOS. So our aim is 30 to 40 minutes of yoga. You should combine with other forms of exercise like cardio and strength training. You practice at least 2 to 3 days of yoga per week along with balanced diet and good sleep and cardio exercises. It will help. So, how to choose healthy eating habits? So, choose fruits, vegetables, whole grains, and protein rich foods. Reduce sugary drinks, processed foods, and eat regular meals. Timing is very important. Actually, intermittent fasting helps in women with PMOS. So, the fasting window, we call it 10 hours and 14 hours of fasting, and 10 hours of eating window will definitely help, and hydration is important. Exercise. One has to exercise, aim at least 30 minutes of exercise per day. It can be either walking, yoga, cycling, dancing. Combine everything. So it will not be monotony. Good sleep supports hormone balance and stress reduction also improves health. So this PMOS usually affects the mental health of children, teenagers especially. It affects their confidence and emotional well-being. They are usually anxious or in low mood. So talking to family and friends actually helps. Mental health care is a part of PMOS care. So how doctors diagnose PMOS? So taking your history and your symptoms by doing a physical examinations, we usually order some basic blood tests which will screen your metabolic syndrome also, like fasting insulin, your fasting blood sugar, your lipid profile, and ultrasound scans and hormonal profiles. We usually do all these blood tests and come to a diagnosis about your PMOS. So, what are the treatment options? The first foundation for the treatment of PMOS is lifestyle changes. As I said, diet, exercise, sleep, and reduction of stress with yoga helps, and medicines help to an extent, but should be first line of management is lifestyle change only. So treatment depends on the symptoms and future goals. If somebody wants to reduce weight, there is a proper treatment, particular treatment for that. If somebody wants to conceive, there is another treatment for that. If somebody's aim is to get regular periods, the treatment is different. And if somebody wants to get rid of their acne and hirsutism and darkness in the neck, the treatment will be different. So the treatment depends on your goals, and regular follow-up is very important. So there are some myths versus facts. The myth is PCOS only affects overweight women. It is a myth. The fact is PCOS can affect women of all body types. Even thin women can be affected with PCOS. Women with PCOS cannot get pregnant, so this is a big myth. They will have difficulty in getting pregnant, but with adoption of healthy lifestyle changes, good diet and exercise, women with PCOS can definitely get naturally pregnant. So PCOS is caused by eating one type of food? No, PCOS has multiple hormonal and genetic causes also. So when should you see a doctor? PCOS periods are absent for many months. You're not getting a period for 3 months or 6 months. You should definitely see a doctor. Rapid weight gain with severe acne, severe pimples. So you should see the doctor. Excessive hair growth or hair loss, difficulty in getting pregnant, and concerns about mood, stress, and body image. So the take-home message is PCOS is common and manageable. It affects the effects of PCOS are more and beyond just the simple irregular periods. Healthy lifestyle habits make a big difference. Early awareness and support improve the quality of life, and regular medical guidance is very important for women with PCOS. So, thank you. I'm open for some questions. Doctor, my daughter is 15 years old and her periods are very irregular. Everyone at home says it's normal at this age. Should we still get her checked for PCOS? See, when you said it is very irregular, you should, like, how irregular are they? If they are, if she has attained her period at least just 1 year back, you can as well wait for a year more. But if she is after a prolonged amenorrhea, which means lack of periods for 2 or 3 months, she is getting a period which is lasting for more than 10 days, or if she is having heavy bleeding, definitely you should see the doctor, because she might lose a substantial amount of blood. There will be a lot of bleeding and she'll get anemic. So we should address that. And it is always a good practice to do her hormonal profile so as to see if everything is normal. Check her thyroid levels also. The next question, I am getting my periods once in 2 to 3 months along with severe acne and weight gain. Could this be PCOS? Yeah, this could be PCOS, because for the diagnosis of PCOS, we have 3 criteria. One is irregular cycles, oligo or anovulation. Next thing is your metabolic thing, like with your hormonal, biochemical, or physically you have signs of hyperandrogenism, we call it. So your acne itself tells that you have a sign of hyperandrogenism. And the third thing is, if we see those ovaries, a particular pattern of all the arrested follicles in the ovary in the scan, this is the third thing. Any 2 criteria would meet the criteria of any 2. If any 2 are present, you will meet the criteria for PCOS. So in this you have 2 things. One thing is irregular cycles, one thing, and next is acne. So yeah, definitely you should, this could be PCOS. You should get evaluated. Any questions? Doctor, the third question is, Doctor, I have facial hair growth and hair fall for the past few months. Is this related to hormonal imbalance or PCOS? See, not every time your facial hair growth or hair fall. See, as I said, there is a particular criteria for this. If you meet the criteria, then it could be PCOS. But yeah, you have to do a certain blood workup to find out whether this is because of PCOS or not. I'm married and trying to conceive for almost a year. Recently, I was diagnosed. Can I still get pregnant naturally? Yes, definitely you can get pregnant naturally. You have been married for almost a year. So now you adapt to healthy lifestyle and try for the next 6 months to lose at least 10% of your weight so that you will naturally ovulate and might naturally get pregnant as well. Doctor, my daughter is 15 years old and she still hasn't got her first period. What could be the reason? Is it normal or it can lead to any health issue later? Mm, yeah. So now, if there is secondary sexual characters, and but for that you should go to the doctor for an evaluation because since she's 15 years old, the doctor would once see for development of secondary sexual characters like breast bud and pubic and axillary hair and all that, and let you know whether you can is it okay to wait for a year more or you should further get evaluated. I work night shifts and my sleep schedule is very poor. Can stress and lack of sleep person? Yes, definitely. Your stress and lack of sleep will affect the PCOS definitely because if you don't sleep, there is a hormone called GnRH which is secreted from the brain, which is not which is usually secreted in the nights. If you don't sleep properly, it will not secrete properly. So the ovulation doesn't happen. Number two, there is something called melatonin which gets secreted in the night around 10 o'clock after you sleep, and it's a hormone that is secreted in sleep. So that also doesn't get secreted properly, which leads to increase in cortisol levels, more stress, more PCOS, more stress eating. So definitely, I am not overweight, but my scan shows PCOS. I thought only obese women. No, it's a myth. No, there are many thin women who have PCOS. It's basically insulin resistance. It's more genetic. Somebody you see you see many people who are very thin yet they get affected by diabetes. In the same way, thin women also get PCOS. However, exercise even in thin women helps to overcome insulin resistance and PCOS. I have PCOS with endometrial thickness. Yes, PCOS causes increased endometrial thickness because there is no ovulation. So there is only estrogen, unopposed estrogen. Usually, when ovulation happens at 14th day, on 14th day, after the ovulation, there is a hormone called progesterone. The purpose of progesterone is to thin the endometrium. It thins the endometrium like it is like a sock, so the endometrial thickness decreases. So women who have PCOS and who suffer from PCOS usually do not ovulate regularly, which is why their endometrial thickness is endometrium is on constant uh, estrogen hyperestrogenated. So there is no progesterone support. That is why the endometrial thickness will be high. And once they get bleeding also, once they get a withdrawal bleeding also, they'll have a little high, heavy bleeding. Doctor, can PCOS be cured permanently, or is it something we have to manage lifelong? See, PCOS, you see it in the reproductive perspective, like you are seeing it like a problem of the ovaries, isn't it? But that's what I was telling. It is now changed. The term itself has changed to polyendocrine metabolic ovarian syndrome. So it is not something that is related to just the ovaries. It is related to the entire body. So if you manage PCOS with your lifestyle, weight loss, and healthy eating habits, you can manage it lifelong. Uh, so it's like you have to be healthy throughout your life. You have to follow all this. You need not take medication throughout your life. If you don't have the metabolic syndrome, you can, everything can be changed. Almost everything can be changed with diet and exercise. 80% of it. It can be cured. Many people advise me to completely stop eating rice and carbs for PCOS. Is it really necessary? This is a tricky question, one, because we are all rice eaters. Basically, this whatever rice we eat is has a very high glycemic index because the sugar level rises, white rice especially. So you can as well change to brown rice, combine white rice and brown rice. Eat low glycemic index rice. That will help. You need not completely stop eating rice. You cannot go on like that, because your serotonin levels in the brain decreases and you get depressed if you don't eat rice, because we are adopted like that. So you have to limit the white rice or white sugar or carbs or white bread, whatever it is, whichever has a high glycemic index. You can choose more better options like brown rice, so that will actually help. Some form of carbohydrates you have to take. So complex carbohydrates are what you have to take, like whole grains, pulses, and something that has more fiber, so that there will be graded increase in the sugar levels. Any more questions? I don't know. Thank you, everyone. Should I mind?